Welcome back. Now, you might think you are the only one dealing with it, but honestly, you aren't. Many folks are struggling with bladder disorders and chronic pelvic pain, and UTMC has a new clinic which could help you. This afternoon, we have to talk with Dr. Ahmed El-Zawahry, there he is, to talk more about treating those types of conditions. So, doctor, when it comes to overactive bladder issues, some folks, because it's not comfortable to talk about, you kind of feel embarrassed, but it's actually a common thing, correct?
It is very common, and to learn about the magnitude of this problem, think about it is affecting every age group, and actually it increases as we age. So once you reach to age about 60 years old, you are going to have a chance about 30 to 40% of having some sort of overactive bladder. And overactive bladder means you have a frequency and you feel the urge to go. So you feel like I need to rush to the bathroom all the time. And at times you can leak before even you reach the bathroom. And this is, you can tell, it is very cumbersome, because if you are working, if you're trying to socialize, you feel like you are owned by your bladder. You're owned by the bathroom. You don't have the quality of life you want. So that is a huge problem. And yes, you're correct. People are always concerned about coming to the clinic to talk about this, but I always tell people what happens in the clinic is like stays in the clinic. So you don't need to be concerned about it.
So embarrassed, but at the same time, you're here to help. But like you said, as you get older, I should just dismiss it then. Because like you said, it's a common problem, but we shouldn't just accept that this is life now, because it doesn't have to be.
You are correct. Especially now we have a lot of treatments. Usually we start from the lower end of the treatment and escalate as we go. And although it's a quality of life, think about it, it is actually can affect your life. Why? Because if you have overactive bladder, it can be a reflection of other problems you have. Someone can have congestive heart failure and they don't know, COPD, sleep apnea, diabetes. A lot of these patients come to us whenever, especially young, and they have problems with their bladder, and all of a sudden we tell them, no, go to meet with a cardiologist. Or if they have some MS, tell them, no, you have a problem with that, because the bladder can tell us some of this news. So it's not only bladder issue, it can be a reflection of others. The other thing is, when you get old and you have this problem, what you do is, I don't want to leak. I need to rush to the bathroom. So when you're rushing to the bathroom, what can happen? You can stumble or something, you can fall. And the problems, if you look it up, it's going to be like if you have a fracture in your hip or your femur or something like this, you are very difficult to recover when you're older. So that's why it's not really preventing only a quality of life, but it can affect your life later on.
When it comes to the bladder, so folks who are not doctors who've been studying this for many, many years, by the way, he said 1990s, that's early, he's done it. It's more a problem with, I see in my notes, pelvic floor or colorectal issues. So it's, like you said, it's a combination of things, but it's not just your bladder. It's...
Yes, so you're hitting on the target. So pelvic floor is basically what is living in the pelvic floor. So we have the bladder, we have the genital uterus and vagina and prostate in men, and we have the rectum. So all of these are contributing to the pelvic floor. And when we are talking about pelvic floor, it addresses any of the, we call it dysfunction, or some abnormalities in any of the function on those. So when you translate into what is happening, if someone has constipation, diverticulosis, hernia, rectal prolapse, and this is why we have our clinic, because it addresses all these different specialties in one location. So we have people who are addressing colorectal issues, we have people who are addressing female issues, male issues, urologic issues, or female urology, and we have physical therapy, and we have infectious disease, and we are growing as we go.
So just to recap, so it does man or woman, old or young, it's everybody who has to likely experience this, and it might not be just one thing. It could be a series of things. So being embarrassed about it helps no one.
No, it doesn't help, and it progresses. So whenever you come earlier, it can be something simple that we can treat. When you get a little bit later, it can be difficult. And I'm going to take you to another trip, like for example, enlarged prostate. We have a lot of men come with frequency, urgency, difficulty voiding. And when you look into the statistics, you have about 25 million men with enlarged prostate. Who comes to treat? 2%.
That is a very small amount.
Very small amount. So that is why it is like the magnitude of the problem is huge. And actually, when you think about it, this is why UTMC thought about having this clinic. So the leadership said, oh, we need to serve our community. And we think that this area is underserved. So we need to have some group of people to help us. And this is why they start thinking about this project and helped us to do that.
Doctor, thank you so much for coming today. Of course, we can see the information there on our screen, so hopefully we have convinced you. Again, it's not just something you have to live with. It is definitely something that you can come and go talk to Dr. El-Zawahry about, because, again, he's here to help. He's not here to shame. Thank you so much.
Thank you.
All right.